There you go. Now we're live. Good morning.
Good morning. How are you?
I'm good. How are you?
I'm good. Thank you.
Okay. Thank you for coming. And, first of all, I wanted to thank you, for joining us at our Facebook page. First and foremost, we wanted to thank you for bringing ABA internationally because I think a lot of us were just left like without anything when the BACB had announced that they're not going to be able to support the whole world internationally. So thanks a lot for that, it means a lot for us because I think the world needs regulation in ABA services, and that means a lot for all of us. Thank you so much.
Yeah, thanks for the opportunity to talk about it.
Okay. With that being said, I would just like to introduce a little bit about the IBAO. As much as I know, IBAO came into being in 2020, I guess, right?
2020.
2020. And it's the International Board of International Behavior Analysis Organization.
Yes.
And it is going to be regulating the behavior analysts internationally.
Well, we're going to certify behavior analysts internationally. Okay. Regulation is kind of part of it and kind of outside the scope of certifications, but we can kind of dive into that at some point if you want.
Right. So with that being said, I would like you to introduce yourself and then a little bit about the organization and, where we're going to go from here. If you could let us know, that would be great.
Sure. Yeah, thanks. I'm Mike Muler. I've been in behavior analysis for about 25 years. We do clinical consultation in the state of Georgia, in the U.S. Primary clinical interests are assessment and treatment of severe problem behavior in public school settings. So our clinical organization we've had since 2005, and it's kind of a niche specialty area for an ABA company because we don't really provide much in terms of early intensive behavior intervention, which is the norm. Our focus is almost exclusively on reducing problem behaviors in public school settings. So it's a little different from that respect. So we've been, like my personal experience in behavior analysis, I've worked in kind of institutional type settings, group homes, community settings, public schools and private schools. I've been in homes and communities. We have a focus in the last 10 years or so when it comes to skill acquisition, working with slightly older learners. We published the AFLs in 2012, and that brought a kind of a highlight to skills of daily living and functional skills and skills that lead to independence, which is just I can't even put into words how important that is. I know sometimes it kind of gets left out of the conversation because when kids are really young, and this is the way that it should be, but when kids are really young, obviously you focus on language and communication. But I go around sort of preaching about the importance of working functional skills into those programs so that when someone gets into their early teens, late teens, young adulthood, they are as capable as possible of taking care of themselves. So because I've had the opportunity to go and travel and train on the AFLs and talk about these different things, I've also been fortunate to have the opportunity to do some of that internationally. And it was during one of these international trainings that had just followed the BACB's decision that I saw that the impact, at least to this particular group, about, the negative impact, I should say, for this particular group. And it really moved me to try to be involved in a future solution, which is what led to IBAO being formed in January of 2020. And so from January of 2020 for about the next year and a half, we had formed a professional advisory board, behavior analysts from all over the world. That advisory board was broken into committees, and then the committees each created what are now the requirements for the International Behavior Analyst, which is a behavior analyst certification, and the International Behavior Therapist, which is the therapist / technician certification. After those goals were met, and so by goals, I mean we created what the certifications were going to be. We came up with the requirements for those, including all what education is required, what concepts, skills, objectives are required for both. There were the creation of the exam items and validity testing on the exam items, which was a pretty intensive process. Ethical guidelines, ethical problem-solving model, a way to present the information. So once all of that was actually created, the goals had shifted since then to essentially education about the organization, education about the certifications, and then getting everything translated into as many local languages as possible.
Right.
So that's the last 2.5 years have been a very creative process, and then a process of dissemination and awareness.
Right. Thank you for that. So now, as far as we go, we have the International Behavior Therapist certification, as well as we have the International Behavior Analyst certification. Now, for the International Behavior Therapist, it's going to be like the RBT, which is the Registered Behavior Technician.
Yes.
But because I went through the process, and you graciously helped us a lot with that, so it's more than 40 hours, and which is great, because I think that it also incorporates not only autism but Down syndrome and intellectual disability and ADHD, which I think that we didn't touch with the RBT. Now, would you like to just let us know a little bit about the process that after the IBT is done, like the training is done, then is the process just like the RBT, or is it a little bit different? Because I know for RBT, most of the candidates, they had to fly to different countries if they didn't have the exam centers. Like, yes, post-COVID, yes, most of the people were able to take the exam in Pakistan, for example, or, in their countries. But prior to that, they had to fly to those countries where there were exam centers. So could you talk a little bit about that?
Yeah, I'd be happy to. There are some really important differences between the RBT process and the IBT process. Let me just address the test centers thing. Like when we first formed the Professional Advisory Board, one of the first goals that we had was just understanding issues around the world that were keeping people from getting certified or even being interested in certification in the first place. And one of the things that kept coming up was this testing process where you had to go to a certain building in a certain room and have someone stand behind you. Testing centers, as you said, don't even exist in some countries. And if they do, they're not close. So here you have an entire population of people that has to, buy a train ticket, a plane ticket, fly internationally, buy a hotel just to go and take, what's kind of a stressful exam. And it really, to be honest, it seemed a little ridiculous because in 2020, 2021, 2022, there are just, these robust testing options. There's online university programs, online college programs, online degree programs. They all use online testing. So to go through this kind of process and then have to go physically to a building at a certain time and date just seemed very antiquated, honestly. So we don't have those requirements. Our exams are online. The proctoring software uses your computer's camera and microphone. It records the test taking process, and they've had thousands and thousands of people take online exams. So there's an algorithm that can detect what's typical test taking behavior, and then things that would be red flags that could be indicative of atypical behavior. So it records that, and then a human reviews it. So the proctoring part of the exam itself doesn't say you pass or you fail or you cheated or you didn't cheat. It just looks for irregularities, and then someone goes in and reviews that. So for instance, if someone gets up out of their chair, that would be noted. If two people are in the screen, that would be noted. If someone tries to click onto a different tab, that would be noted. If a cat jumps in someone's lap and they do these kind of things, that would be noted too, but we could see. So when most people are taking an exam, they're looking straight ahead, they're reading the screen, they're choosing the answer. So if someone is clearly kind of looking to what could be a reference material or something else, all of that would be flagged. So all of that to say, there are really secure test taking options that don't require travel and those kind of arrangements. You can take these exams anywhere at any time, whatever's convenient. This could be 1 o'clock in the morning. This could be 8 o'clock in the morning. It could be the middle of the afternoon. As long as you have a quiet test taking place and secure internet access, the exams go off without a hitch. But some of the differences, I can just kind of walk you through the IBT process and then highlight the differences. Basically, the RBT process is 40 hours of behavior analysis education and then a competency exam. The IBT has the same 40 hours. I wouldn't say the same 40 hours. The amount of time is 40 hours. There are differences in content. We did a survey very early on and asked what are the populations of learners that the therapists are serving. And that's how we got the list of autism, Down syndrome, intellectual disabilities, ADHD. Those were the top. So this isn't the education related to that is not a deep dive into those. I mean, you can study these and you can write dissertations on small, bits of these, but an awareness of the types of characteristics of the clients that someone is likely to work with is important. So you have to know, or you will be taught the characteristics of autism and Down syndrome and intellectual disabilities and ADHD. Other than that, the content overlaps significantly. The IBT is a practice certification. So where the IBA is an applied behavior analysis certification, but there's so many different roles that IBAs have. There's fewer roles that IBTs have. So it was easier to bring some of that into specific practice. But 40 hours of required educational objectives. And then probably the biggest difference is we have a practice and supervision requirement. So this is essentially your on-the-job training for that role. There's 300 hours of practice. 10 of those hours have to be supervised by a behavior analyst. You also, the other difference is you have to have 4 continuing education units, 2 in general ABA topics. This allows someone to get a little bit extra training in an area of their interest. There's an hour of ethics and an hour of cultural issues. So the cultural CEUs in general differ from the BACB requirements. They don't have that category. They have ethics and supervision and then general ABA. We had a cultural category just to highlight cultural differences in different places in the world. It can sync very well with ethics, which are contextual, but it is kind of its own bucket. So once you finish those requirements, then you can sit for the IBT exam, which is, there's also skills testing. Okay. So we have 40 hours of education, 300 hours of practice, 10 hours of supervision. The supervisor also does 2 skills tests. Okay. So this is different than the competency exam. The competency exam is a static set of skills that everybody has to do. The skills testing is up to the supervisor and the candidate about which skills, what services, what they're implementing is evaluated. So if someone's doing pediatric feeding protocols, you would evaluate the implementation of that. If someone's doing functional analysis or differential reinforcement schedules or discrete trials or whatever it happens to be, that's what's evaluated. So once those are done, then they can sit for the exam.
Okay. So I think this is a more what you can say as a more detailed process to become an international behavior therapist, because I think that this is going to give more, validity to a therapist by getting those 300 hours being supervised and then taking the 2 skills assessment, because they are going to get better at what they do by, taking this exam and by going through this training. So it's more than what we were doing before with the RBT.
Yeah, it's important too, because with respect to the RBT training, you can get that training online, and then you can do the competency all in role play, and you don't actually have to contact clients for getting that. And there's a lot of people who get into the field that realize maybe this isn't right for me because they don't have those experiences before they get these jobs. And it's been pointed out in a lot of recent literature and conference talks and things like that, that it can lead to burnout and turnover and staff satisfaction issues. So this is, you get the education, and then you practice this under supervision. You get help and you get guidance. You get coaching and you get feedback. And like you said, the things that you're doing are evaluated. And although it is pass fail from our perspective, it's a coaching, mentoring, supervision process that they go through, so that when they get to the exam and they pass that, they have the knowledge, they have a history of doing this now. And when they start working with that certification, they can kind of hit the ground running relative to that being the starting point for everything they're going to do after that.
Right. I think that's great. So now we come to the supervisors, which are the international behavior analysts. And we have 2 levels, right? We have a master's level, and then we have a bachelor's level. So if you would like to, I know that, like, I got my certification because I am a BCBA and I just got mine converted. But then, in different countries, like, in Southeast Asia, in Asia, and Africa, in, UAE, where there are not a lot of BCBAs or BCABAs, and they cannot get their, certificates converted. And 2023 is approaching. So for them, people who want to go through the International Behavior Analyst certification, could you just, like, I know it's a lot to cover because you spent 2.5 years doing that, but could you just let us know a little bit about the bachelor's level and the master's level for those people who want to become international behavior analysts? Because IBTs are going to be there and they're going to be in the field, but we need more supervisors to supervise them. And autism is growing, disabilities, we have so many kids with disabilities, adults with disabilities. We need supervisors.
Yeah, it's a problem. It's a problem that we hope to help solve. It'll be solved locally. Hopefully we can support those issues, but it is a lack of supervisors, relatively speaking, is a problem in different places. And again, we hope to change that. So the International Behavior Analyst, the IBA, can be obtained with or without a master's degree. So the certification itself is the same, even though there are different routes to obtain it. And here's why. When we were going through the process of deciding what certifications should be offered, what's actually needed, we debated, following the model that the BACB created, where you can have a bachelor's level, assistant or associate type level, then you can have the behavior analyst level, and then you can have a doctoral level. And when we started to examine exactly what goes in to these different certifications and what's important, the board quickly, kind of came to the realization that the master's degree itself is not irrelevant, but it also more often than not doesn't add anything to the behavior analysis education that someone receives. So this is what that means. You can be a master's level behavior analyst and your master's degree can be in finance or history or education or clinical psychology or any number of things where the master's degree itself doesn't add any applied behavior analysis or behavior analysis knowledge. I've told this story a couple times, but in our own practice, we had a master's level BCBA, and she was clever, she was analytical, she was bright, she was awesome with kids. Her master's degree was in physical education. She was a tennis pro who got hurt and then wanted to work with children with autism. She had already attained her master's degree. She just added the verified course sequence. So she was a master's BCBA. She didn't have any, I mean, like I said, her master's degree is in tennis, basically. So she didn't have any classes, any education at all beyond the VCS. So if you can get a master's degree in applied behavior analysis, you probably should. That would be my personal recommendation, that if IBAO had an opinion on it, I think that would be the opinion of the organization. Not everybody has that opportunity. Due to cost, availability locally, language issues, a lot of colleges and universities don't have this. The VCS had to be a credit-bearing institution that provided these classes. And a lot of places don't have university master's programs around them. And so if you don't have one, it's not in the local language, it's very, very difficult to get that education. So if you can get a master's degree in ABA, you should. And master's degrees just in general are probably quite valuable in some ways, not necessarily with respect to ABA education, but just in general, organization, time management, leading group presentations, the different, projects and things that are assigned that are probably incredibly helpful just in a very general way. But as it relates to ABA education specifically, if you get the 270 hours of ABA education and someone has a master's degree in education and the 270 hours, you have the same amount of relevant education in the field. So if you can get a master's degree, you should get a master's degree. It'll be helpful in many ways, but a lot of people, like I said, you can't. So we have two different routes. You can get the 270 hours of our required educational objectives. This can come from a verified course sequence, which is a university or college. It can also come from a non-credit bearing institution or organization. So there are non-college, non-university organizations that are now approved to provide that education. So this opens up possibilities that didn't exist before, because now you have behavior analysts who are spreading the word and doing the education, and you don't have to change, the course catalog, and you don't have to fight the bureaucracy, and you don't have to convince the university to hire faculty and do all these things that prevented these programs from existing in many places. There are organizations who can provide this education. Our concern is that someone gets the education. It doesn't really matter whether or not they get college credit for the education. If that's of interest to them, that's fine, but that's not what's important from a certification requirement. So if you have a master's degree, or if you don't have a master's degree, you can get the IBA, and the rest of the requirements vary only slightly. So if you have a master's degree, when you register for the IBA, you choose the master's route. And then your requirements are, after the 270 hours, you have 1,000 hours of practice, 50 hours of supervision. You also have 2 live skills tests. You have to get 12 CEUs, and then you can sit for the IBA exam, which again is an online exam. If you don't have a master's degree, then when you register for the IBA, you choose what we call the experience route. Same 270 hours is required, the same 1,000 hours of practice, the same 50 hours of supervision, 2 skill tests, but there's an additional requirement that you have 2 supervisor assigned projects. Right. So as I mentioned, we do feel like there is some value, obviously, of having an advanced degree and going through the process of obtaining that. So even though it doesn't relate directly to ABA necessarily, there's value to it. So we've decided to try to add some of that in by having supervisor projects. So this could be a literature review. This could be a PowerPoint presentation. This could be a research proposal. This could be a different type of assessment. The candidate and the supervisor decide what these projects are going to be, and then the supervisor evaluates those. And then, so that's the additional requirement for that. And then you take the same online exam. So the certification is exactly the same. There are just different routes to obtaining it.
Okay. So this is going to be the bachelor's level and the master's level, and there are different ways to obtain that certification.
You can get the certification with bachelor's level educational history or master's level. Yes.
Okay. And then there are approved content providers that are on the website that anybody can go through. They're on the IBAO website that anybody can go through, and they can go through the program and then go through the 270 hours, which is in the program, and then the 1,000 hours of field work and the supervision and the 50 hours of supervision, and then they can go for the exam after that.
Yes, there's a list of approved content providers. The educational requirement at this point does not have to come from an approved content provider.
Okay.
So if there is a VCS, right, a verified course sequence, the verified course sequence process is handled by ABAI.
Right.
It used to be a BACB task, and they, I guess, kind of farmed it out to ABAI. So ABAI is the one who says this course sequence is verified. So if there is an ABAI verified course sequence of either the 4th edition task list or 5th edition task list, we will accept that.
Okay.
IBAO is trying to be flexible with respect to people having started the process with the BACB, but not finishing it.
Okay. So
for instance, if kind of starting at the very top, if someone has a BACB or someone has an RBT, they can add either the IBA in the case of the BCBA, or they can add the IBT in the case of the RBT. So they're demonstrating that they met our requirements by having this other certification. If someone has gone through the entire process of trying to get the BCBA, but let's say, for instance, they're not going to be able to take the exam in time, we would accept all of their requirements, and we would only require that they take our exam.
Okay. So like this transition period right now, because now it's August, and the exam is, like by December, if there are people who are not able to take their exam and they have all the requirements fulfilled, then they can go ahead and apply to the IBAO board.
Yes, we're not going to require anybody to redo anything.
Okay.
We understand the time commitment, the expense, the dedication that it took to do all those things. So if someone has 5 hours of practice or 500 hours of practice or 900 hours, we will accept those as long as they're on, verifiable supervision documents. And then they would only have to go from where they have been to the end of our process. So let's say someone has completed the educational part and they have 500 hours of supervision, and they're not going to be able to get the rest before December. We would accept their education as meeting our required educational objectives. We would take their 500 hours of supervision that they've already, or the 500 hours of practice and supervision, and they would only have to go from there to the rest of the requirements. So they wouldn't have to start the process over. We're just trying to be flexible and meet people where they're at. We understand it's difficult enough, so they don't have to redo it. Our interest is that they've had the practice, that they've had the supervision. If it was for one certification or another, we'll accept that and just meet them where they're at and just help them, guide them the rest of the way.
Okay. Right. So another question that I had was that when, like, with all of the countries, different countries, and all the material that is being translated, so the everything, like with the all the content from the IBO, like all the content material is also being translated, or just a few things are being translated at this point?
Well, right now, everything is being translated
Okay.
into as many languages as possible. I can pull up, we have Spanish, French, Portuguese, Filipino, Turkish, Arabic. We have Ukrainian and Russian, both in the works, Romanian, Lithuanian, what else? Hindi. So, I mean, our goal is to have as many languages translated, or to have our materials translated into as many languages as possible. So all the requirements in the website was first created in English, and then now it's being translated from English. So that means the required educational objectives document, the IBA requirements, the IBT requirements, the training content for IBT, the ethical guidelines and problem-solving model, everything that tells people what they have to do and how to get there. And then, of course, the exams, the IBT exam and the IBA exam. So first, we're trying to get all the documentation translated, and then after that, the translation teams are doing translations of the exams. So it's really everything. We're trying to get to the point where someone doesn't have to be a fluent reader, speaker, writer, test taker in English to be certified as a behavior analyst.
Okay. So another question is that we have, like, as per the BACB, when you are a BCABA, which is a bachelor's level, assistant behavior analyst, you need to be supervised by a BCBA. Is that so with the IBAO? Do they still have to be supervised at the bachelor's level?
No, the certification is exactly the same, because like I said, the education, the practice, the supervision, the skills testing, passing the exam, all of that is exactly the same. So if you have somebody with a bachelor's degree who goes through that exact process, they're getting the exact same amount of ABA and behavior analysis education, the same supervision history, the same practice experience. They've done the same exam. They've completed the same skills testing. So regardless of how you get there, the certification and the expectations to maintain it are exactly the same. So a bachelor's level person that has an IBA does not have to be supervised. They have the behavior analysis certification at that point.
Okay. So there is no difference, like they are going to be the same. And there is no difference, because that was the question that had come up.
There's no difference whatsoever. Because if you think about it, and it's changed over time, because I think if you and I don't have, this isn't a database thing, this is based on my own opinion and my own knowledge and information in the field. I've been around for a little while and I've seen this change a little bit. Right now in our field, at least in the US, there are a lot of options to get a master's degree in ABA.
Right.
But that's a relatively new thing. 10 years ago, there weren't that many options. So the people had, what is considered related fields, and I'm doing that on purpose, because if you have a related field of psychology, some psychology programs, if you get a master's degree in clinical psychology, you're not going to learn any applied behavior analysis.
Right.
If you get a master's degree in education or special education, very, very, very rare that those programs contain ABA education. You don't have whole classes. It's probably mentioned in a class of intervention or something. So these fields that are considered related, they're related in general, but they don't add any education component. You don't learn any more about motivating operations and reinforcement theory in these classes. You just have a general alignment afterwards with something that in locations where behavior analyst practice. So there is no additional benefit as it strictly relates to practicing in our field. If you have an education degree, special education degree, and of course, once you open that up to what's considered non-related fields, history, finance, sociology, all these other kinds of things, the benefit, if there is one, gets further and further away. So we're holding all of the standards and requirements constant as it relates to what's relevant for applied behavior analysis. And if you have a master's degree, or if you don't have a master's degree, to go through the requirements, you're getting the same everything. All the requirements are the same. So like I said, if you're fortunate enough to be in an area where and can afford the ABA master's program, you should. That would be beneficial for you. But a lot of places don't have them. A lot of places it's too expensive. A lot of places don't have them available in their local languages, and there's other barriers. So as long as you get the ABA requirements, having a master's degree, I mean, I have a PhD. I have the BCBA-D. I don't have a single class extra in ABA than someone with the BCBA. My master's and PhD are in school psychology. We had some behavioral classes in school psychology, but this was before they had BCSs. So we basically had the educational the educational component for the BCBA rolled into our thing. So I have a PhD, but I don't have any more behavior analysis education than someone who goes through the BCS today. In fact, the educational requirements have been ramped up. When I have my BCBA goes back to 2002, and at the time the requirement was only 180 hours of education. It's gone. It's crept up over time. So, these things change. But the point being, you can have a PhD in something other than behavior analysis, and someone can have just as much education in behavior analysis as you do, as I do. So, kind of peeling back the things that are relevant, it's the behavior analysis education itself that's relevant to a certification in behavior analysis. So that's how we ended up there.
Okay. Just, maybe two more questions. One is about the professional advisory board. How is the professional advisory board going to help all the different countries? How would it help to disseminate? And that kind of ties it into the ethical, boundaries of how to disseminate the right kind of ABA so that we can get rid of all the, as I say, quacks and, the non-ABA kind of, interventions that are going on. If you could just talk about that a little bit.
Yeah, I mean, it brings up the reason why this organization exists at all is because as autism awareness grows, as the effective treatments for issues related to autism are better understood, ABA is growing all around the world.
Yes.
And there's people that are saying they are practicing ABA all around the world that are not kind of operating within what we would consider industry standards. The consumers of our services are very confused in many times because they don't know what it is. Even here, we get calls. My son or daughter has been diagnosed with autism. We were told we need OT, PT, speech, and ABA. We got your number. What is it? There's still kind of a lack of general awareness about what it is. And you have these situations where in some instances, there's a very negative perception about ABA that's based on misinformation or old information or the spread of someone's negative opinion, perhaps because they've had experiences from people who aren't practicing ethically or aren't providing, fair and safe practice. So, I mean, the main reason that certification bodies exist is to allow people to see who does have the right education, experience, history, and knowledge base to practice safely and ethically. And the more people that get certified, one, the more people that will be, trained properly and go through the right experiences, but it's also, it will allow the consumers to see who has this and who doesn't, right? Who's practicing within our industry standards and who's falling outside of that. And that will both protect consumers from bad actors and quacks. And it will also just make it much, much easier for people to say, to understand whose advice should be taken and followed, and who doesn't have the background to be giving advice in the first place. So the professional advisory board, to kind of get back to your question, the professional advisory board is now 80 people all around the world. And we're honored to have you included on that list. We're very pleased with that. The advisory board's role has changed over time. Initially, it was, again, to create the things that are now the certifications and the requirements and the ethical guidelines. It's changed since then, as I mentioned, to disseminate and educate people about this. So this is all people in their local area trying to disseminate appropriate ABA information, trying to educate the local populations about what it is, what it's not, dispel myths, and provide better information and education that's out there. So it's kind of like a grassroots movement. The approach is slightly different and slightly different in different areas, because it's based on where, I guess, the ABA infrastructure, if you want to call it that, already is. Some areas in some countries really have none at all. So they're just now forming what would be chapters and societies and sort of banding together. Others have had that, for 10 or 15 years. And the process is a little bit different. Part of it is translation. Once the documents are translated, then both candidates and consumers of our services can have a transparent look into what are the professional expectations of people in our field, because it's not well known. If you say to somebody, tell me about a plumber, tell me about an attorney, there is at least some awareness of the general, roles and responsibilities of these professionals. If you say, tell me about a behavior analyst, most people don't know.
Right.
So it's important to let people know what we do and how we do it, how we operate, that we have an ethics code. And the more that gets out, and the better known that is, the better the community and consumers will appreciate appropriate practice, culturally sensitive practice, and ethical practice, and be able to more easily recognize people that aren't doing those things very well. So it's important.
Yeah, I think that was about it. I think ethics was the second part, and we intertwined it together. I think ethics is the most important part of what we do. And other than that, I don't see any questions here. So if there are any questions, I can try to answer them. If not, I can always try to ask you and then answer. But we're very excited for this opportunity, and hopefully we want to see this very successful. And we just wish, IBAO best of luck. Thank you so much for everything.
Well, it's, IBAO as an organization, it is only there to support people like yourself who are making the real difference in the areas that are represented. We get sometimes asked about kind of regulation. That word was mentioned earlier today. Regulation can happen with a certification organization effectively, probably only after the majority of providers are certified.
Right.
If it's known that to practice in this area, you should have a certification, then not having the certification is something to avoid. So if someone's acting, grossly unethically, the biggest sanction that a certification organization can do is not certify them.
Right.
If the certifications are sporadic, then that person's not going to stand out. If everybody has the certifications and that person doesn't, they're going to have a harder time getting hired. They're going to have a harder time providing services, and they'll be easier to recognize as someone who for whatever the reason, doesn't have the qualifications. So regulation is possible at some point when the certifications are, accepted and known, and a step in the service provision process. And so that's what we're trying to establish.
And it's going to take time to educate everybody. I mean, I've been trying. There have been a lot of people who've been trying for a while now, but I think we're better than what we were. Like when 2014 was different than 2022.
Mm-hmm.
So I think we're making some difference as we go along, but it still will take some time. But we're trying to make that difference, and hopefully it will come. But education is important. Just letting people know about it and educating them as much as we can is important. And everybody has a role to play.
And we are grateful, for your support personally, and BASE's support as a approved content provider. I know you've taken the steps to train and really educate this next wave of behavior therapists and supervising them. So we're grateful for the support and the process, and for the future IBTs and IBAs that are coming through your organization. They're going to be well trained.
Thank you so much. Thank you so much for coming, and thank you for your support. And hopefully we are looking forward for the collaboration. We hope for good everywhere.
Well, we couldn't agree more. So thank you. And thanks for the opportunity to put out this information. Hopefully it's helpful, and then let me know. I'd be happy to respond to, questions and follow-up questions as you get them. So please,
sure. All right. Okay. Thank you. Have a wonderful day. Take care.
All right. You too. Bye-bye.